now there are other families getting it, and just that's been the standard of care. And so how do you help change the thinking and educate around why that's changed? I think part of it, I do want to talk about the risks of antibiotics, because that's one of the reasons why those guidelines I think have changed, potential risks. But what else is going on with that change in thought process?
Yeah, I think it's really important to bring up because I would even have patients who, they had antibiotics sitting in their medicine cabinet.
Yeah, yeah.
So even without me prescribing it to them personally, they would come in as a new patient and say, "Well, don't worry, I already
Right, right.
pre-medicated myself." And then like you don't even have a chance to
Yeah,
talk to
yeah.
them about, why that's not currently recommended. So it can be really challenging because it's not just educating the dental profession and pharmacy professionals, but the patients themselves. And the
Mm-hmm.
dentists can be the first line of defense there. But pharmacists can definitely play a role in helping kind of reinforce that information.
Mm-hmm.
So delivering the message of the risks is really important. And you mentioned going over that. The
Mm-hmm.
risks include antibiotic resistance, right?
Mm-hmm.
So delivering that message to the patient that you might think this is okay, but if you're seeing me twice a year, minimally for dental cleanings, right? And that doesn't take into account anything else we've got to do or any
Mm-hmm.
other
Mm-hmm.
invasive procedures that you have across your body for the rest of the year, right? Or antibiotics you may need for other issues you have during the year. The antibiotic resistance is real, and we are seeing the implications of that in hospital systems, and it's really serious. So delivering that message to the patients about how that resistance can potentially affect them and harm them in the future is important. And then this issue of the appropriate antibiotic being prescribed, right? So if in fact the patient is a candidate for either antibiotic prophylaxis or antibiotic coverage because of a systemic infection, then we want to make sure we're choosing the right antibiotic and educating the patient on that, educating the dentist on that.